Welcome to this presentation on the delegation of insulin administration to non-registered healthcare workers in community nursing teams, a qualitative study. I'm Dr. Karen Stenner, and if you have any comments, please contact me on the email address there. So this was a collaborative project, mainly based at the University of Surrey, led by myself, in collaboration with Professor Jill Mabon, Frida Mould and Colin Shaw, and also with Angela Cook, who's the head of nursing and quality at Shropshire Community Health NHS Trust, and Kirsty Winkley, who is a diabetes specialist nurse and researcher at King's College London. This project was funded by the Dunhill Medical Trust with a focus on improving care for the older people. So we know there are growing numbers of people who have diabetes who also have conditions such as memory loss and arthritis, which means it's not safe for them to inject themselves. Community nursing services are responsible for providing insulin injections to these patients if they are unable to do this themselves and have no one else like a carer or relative that can do this for them. And this can be very challenging at peak times. Community nursing services are overrun often, have a challenging caseload, and this is increasing all the time with the increasing number of people that are living longer with multiple morbidities, coupled with problems with staffing levels and high staff turnover. So in some services, nurses delegate this role of providing insulin injections to healthcare support workers. When a nurse delegates a role, they remain accountable for that activity. Therefore, nurses must be confident that the person they're delegating to is capable of and understands the task or role. So these insulin delegation programs, as they're sometimes known, are restricted to people with type 2 diabetes who have stable blood glucose levels. And this is because their insulin regimes are usually less complicated than patients with type 1 diabetes. And healthcare support workers are trained to provide this service, and they have their competencies assessed by a registered nurse. So there are governance procedures around the delegation of insulin injections. However, there is very little research on this topic. We undertook a review of the delegations of medicines administrations in community nursing internationally, and found that delegation is a complex process that is influenced by role relationships, clarity, and the quality of supervision, to name a few things. The reference is there below for our literature review. We also found that literature on the delegation of insulin injections themselves is limited to local pilot evaluation of pilot schemes in the UK, even though insulin delegation has been occurring for over 10 years in some trusts in the UK. So we felt that research is needed to ensure that insulin administration, when it's delegated, is developed in a way that is acceptable, safe, and beneficial to older people. And that was our focus. The study design is an exploratory study, qualitative. The aim was to explore stakeholder perspectives on the benefits and/or disadvantages of delegation to healthcare support workers in community nursing services. It was in England, and we used a qualitative case study approach, which involved stakeholder interviews. 34 were conducted in total, with patients and relatives, healthcare support workers involved in delegation, registered nurses, and senior managers and clinicians that were involved in the delegation programs. We undertook thematic analysis on the results. It also had to be said that this was within 3 case sites in England, so they were community nursing teams in different areas of England where nurses delegate insulin administration to healthcare support workers. We included 3 different sites in terms of who they delegated this role to, and that included one site where it was healthcare support workers at band 3, one where assistant practitioners at band 4 were delegated this role, and one that delegated to either healthcare assistants or assistant practitioners, to see if there was any variation. So a brief overview of the findings. We found 4 themes: acceptance, conditions for acceptance of insulin delegation, the benefits, and some concerns and strategies used to address those concerns. So briefly, acceptance of insulin delegation, all stakeholders were positive towards an accepting of delegation. However, and they thought that it was essential to maintaining service capacity, especially the staff that we interviewed. They said that it was set to continue because of the increasing caseload of people with diabetes that were requiring assistance in community nursing care, along with what they described as an increasing complexity of patient care that the registered nurses were managing, especially over COVID. There is a lack of awareness, we found, from some patients and family members of the difference between nurse and healthcare support workers. And this was despite the fact that patients were required to sign a consent form to have their injections given by the healthcare support workers. So knowledge and understanding of that over time was not great, could be improved. So although all stakeholders were accepting, there were conditions for accepting delegation. Firstly, that the training and governance procedures were robust and were followed. So there was a robust system of governance, including clarity over responsibilities and procedures for monitoring patient care. The majority of staff were happy with the training provided, including the healthcare support workers, although there were some problems with the delivery, especially to do with online delivery that occurred over the COVID period. Training that was highly rated tended to be more comprehensive, so didn't just focus on how to deliver injections, but looked at wider understanding of diabetes, its management, and the role of diet. And this wider knowledge was thought to help healthcare support workers to be able to spot changes in a patient condition. So very important for patient safety. It was also noted that where training for healthcare support workers and nurses occurred together, this created greater team bonding and confidence, as both were more aware of each other's roles and their level of understanding and knowledge around diabetes care. In terms of assessment and mentorship, healthcare support workers were initially quite anxious about giving insulin injections, as they were aware of the dangers of this medicine. So mentorship and ongoing contact with registered nurses was considered crucial by all for developing confidence and skills in this area. Registered nurse confidence in delegation was also influenced mainly by the extent that the nurses personally knew and trusted the healthcare support workers, and also their personal involvement in assessing their competencies for carrying out insulin injections. So where this became an issue is where the healthcare support workers had come in from perhaps another trust where they had been assessed by somebody else. Then the nurse would need to develop confidence in that healthcare support worker. Benefits were widely reported by all stakeholders and across the board. So benefits for patients were that the injections were given in a more timely manner. Patients were definitely less worried about having their injections, were confident in the community nursing team as a whole, working together. They felt they had good relationships with the team, and there were noted improvements in continuity and the quality of care given. Healthcare support workers themselves enjoyed learning new skills. It improved their job variety, and it also helped with career development. So shining a light on what it might feel like to be a nurse, and some healthcare support workers going on to then train to become a nurse, registered nurse. It also improved their feeling of being valued in the team. For the services and the registered nurses, there was reported improved service efficiency, and very importantly, improved flexibility and responsiveness of the team working, especially during COVID. Nurses felt they had more time to spend with complex and urgent cases. And it was also said to improve team morale and staff retention because it improved team cohesiveness and mutual understanding and respect within the team to be involved in insulin delegation. There were some concerns, and patient safety was one of these. So a concern was that there was a potential risk if healthcare support workers missed the changes to a patient's condition that a registered nurse would identify. However, examples were given where healthcare support workers had identified issues and raised these and passed these on, for example, patients being unwell and requiring hospitalisation. So it seemed that although that was a concern, it actually wasn't occurring in practice. It was actually beneficial in practice. Strategies to address these concerns were that it was crucial to maintain regular contact between patients and registered nurses. So patients weren't only seeing the healthcare support worker, they were seeing registered nurses on a weekly basis as well. That there was daily handover where the healthcare support workers would discuss patient conditions with the nursing team, and that there were protocols to follow. For example, that the healthcare support worker would contact a registered nurse if the patient's blood glucose level was beyond their normal range. They were also concerned about registered nurses' diabetes knowledge and the need to update their knowledge as well, especially given the complexity of diabetes care that was being seen. Importantly for that support was the access to diabetes specialist service and in particular diabetes specialist nurses. And this was found to be patchy across the 3 case sites. And this was considered important because diabetes specialist services were really important for updating community teams in their knowledge, supporting patient review and diabetes review, diabetes care, and also in developing policy input into training and highlighting patient safety issues. And again, this was considered important because the complexity of care being seen in the community is increasing and was notably increased over a COVID pandemic as more patients were being seen in community settings. Another concern was remuneration. So there were inconsistencies in the banding level required across the 3 case sites for the delegation of insulin administration. And there were some concerns about healthcare support workers being given ever more increasing responsibility without an increase in pay. So there were some issues around that were raised. Strategies to manage these concerns were that it's necessary to regularly review the skills mix and diabetes training needs in the community nursing teams, and that trusts review to ensure healthcare support worker pay banding reflects the level of training responsibility. So to conclude, we found that delegation of insulin administration is acceptable at the way it's currently working and governed within case sites, which reflects that found in the pilot studies as well. However, it was due to COVID, we didn't recruit as many patients and carers or relatives as we would have liked because of difficulty accessing. And definitely there is a need for more research and further exploration of patient and relatives or carers' views. There were many benefits reported, and these require further research to verify them. So it would be really good to actually collect some different data on patient benefits and increased service capacity and benefits to healthcare support workers. And it is clear that regular review of caseload complexity and staff skills mix is required. I know there is work ongoing in community nursing services with workload modelling to do this. Monitoring is also required to ensure that teams are able to adhere to delegation policy, particularly during times of pressure, and that goes along with healthcare workers and registered nurses. It's not just limited to healthcare support workers. No conflicts of interest to declare, and thank you for listening. If you do have any questions or comments on this presentation, please contact us directly and we will respond. Thank you very much.